Aloha mai kako, and welcome back to another awesome episode of Transfer Talk. As you know, my name is Travis, and today I'm honored to be speaking with Dr. Stephen Taketa. Since 2013, Dr. Taketa has served an integral role here at UH West Oahu. As a licensed clinical psychologist, Dr. Taketa has helped countless students in truly life-changing ways. And our goal for today is to prioritize mental health. So I think it's important for us as students to better understand the services that Dr. Taketa and his team provide, and which of those services are available for distance education students. Then we'll discuss some relevant strategies that can help college students prevent burnout. So this episode is going to help so many students, and I really just want to extend a heartfelt mahalo to you, Dr. Taketa, for taking the time to come on the podcast. I'm really excited and truly thankful to have you here. And before we jump into the questions, how are you? How's your summer going?
Well, first of all, thank you so much for allowing me to be here and also for what you do. My summer is going great. I'm looking forward to competing in some long distance canoe races. So very much enjoying this summer.
That's really awesome. Are those races going to be live streamed anywhere? Can we show up to support you anywhere? Anything like that?
I, I appreciate it. I'm sure for people that are not into it, it's like kind of like watching grass grow. But thank you for the support. I think that many of them are live streamed. Yeah.
Cool. Awesome. Is it okay if we pivot over into some of the questions that we have for you today?
Sure.
My first question, it's kind of a double question, but what types of services does your team provide? And then also, what topics or issues do you help students address?
So the services that we provide just about the full range of services that somebody might get from a psychologist if they were to receive treatment in the community. So these services are primarily focused on clinical matters. So for example, what that means is that we provide primary care or treatment for a range of psychological issues, problems, or challenges. But the exciting part about working at a college counseling center is I have a rare opportunity, or we have a rare opportunity to provide preventative care. So, what that means is that if you just want to be a better version of yourself, we're able to provide that kind of care free of charge to students. And so, the primary bulk of what we do is we provide supportive care, we provide psychological treatment. And when it is indicated, we do have some capacity to do some formal psychological testing. So most students, about over 50% of the students that we have no serious psychological issue or disability, but are receiving help primarily for things like stress management, dealing with the stress of school, balancing school, personal life conflicts and situations. We deal with a lot of relationship problems, but we also deal with a lot of life existential types of issues. I'm going to graduate from college with this advanced degree. What's next for me? What is the meaning that this has in my life? So that's primarily the bulk of what we provide, but we also provide specific treatments for things like PTSD, obsessive compulsive disorder. We see a lot of students with depression or anxiety disorders. And so we provide a broad range of services to our students.
Gotcha. Okay. And within that broad range, when we think about mental health services, when we think about self-care and therapy practices, right, it's my understanding that there are various kind of sub-disciplines or school of thoughts and approaches within the field. So do the members of your team, do they specialize in different types of therapy, or does your department take more of a kind of like team-directed collaborative approach?
We do a little bit of both. So, because we are a public serving institution, it means that we have to be able to provide generalist care to basically anybody who kind of qualifies or comes to our services that we are able to kind of competently manage and treat. You are correct that there are a broad range of what we call theoretical orientations, and the people on my team are quite diverse with respect to theoretical orientations. So a theoretical orientation is something that professionals typically will talk about. Seldom do we actually disclose what our theoretical orientation is to clients. But what the theoretical orientation does is it allows us to have a conceptual framework to be able to understand and interact with our patients. But because we're licensed providers are providing service under the supervision of a licensed provider, we have to provide what we call best practices and treatment informed care, which means that regardless of our theoretical orientation, we must be knowledgeable and competent in delivering evidence based treatment, things that have been shown by the research to be effective in dealing with whatever problem that we're dealing with or whatever challenge that a student is dealing with. So I hope I answered that question adequately.
Yeah, absolutely. And I think what I'm taking from the response there is that whatever issue or concern a student may have, they can come to you and get care, get help, right? I think that's really vital for students to hear.
Absolutely. And if, because we are all licensed, we have the ability or are supervised by licensed professional, we have the ability to kind of determine if somebody presents with something that's beyond what we're able to provide from a generalist practitioner model. And then in those cases, we don't just drop students, but we try to make recommendations and advocate that they get connected with specialized care in the community to meet their mental health needs.
Gotcha. Okay, so there's those pathways available. Yeah.
That's right.
Very cool. Nice. Okay. So, how can specifically a distance ed student utilize your resources? If we start at the point where a student is contemplating reaching out for help, or say they have been referred to your services by a trusted faculty member or peer, where do they start? And what would you say to a student who is feeling maybe a sense of hesitation or apprehension about starting the process?
Let's talk about the first part about distance education students, right? So, because of the laws that govern mental health and healthcare practices, we can only operate and care for students in the state that we are licensed to provide service. So that means that anybody on any of the islands of Hawaii can come and access free and confidential mental health services from our center. We don't cap service, so students are able to receive as much care as they need. We don't cap people. Let's say if you go more than 6 sessions, we provide care on an ongoing basis. The only limitation there is that we cannot ethically and lawfully provide care, say, to somebody who's currently physically located on the mainland
Mm.
or in another country. So in those situations, we certainly will provide recommendations or encourage that person to reach out to a provider where they are located for safety reasons and also ethical and liability reasons. As long as they are in the state of Hawaii, we would be happy to provide care. We provide service to many students who are on the outer islands, on the Big Island, on Maui, on Kauai, on Molokai. So very happy to provide care to students who are physically located there. So where do people start? So all students, whether they're a distant learner or whether they're here at UH West Oahu or on the island, can start service by emailing UHWO Talk. That's the easiest way to start service. All you have to say is, hey, I'd like to meet with a mental health provider, and we can get you connected with filling out the forms online. So you just click there, read the form, you can sign it. We also very frequently do intakes and provide direct care via telehealth, and we've done that very effectively. And students have benefited, I think, from that service. Then we kind of go move on to the hesitation piece, right? Now, the truth is that as a psychologist, I did not start receiving my own mental health treatment until after I was a psychologist. And so I share that because even though I have an advanced degree on the topic, I was hesitant and kind of anxious to reach out for help. And so I share that because I don't want people to wait until they feel comfortable reaching out for help. I think that if you are dealing with anything that you feel you could improve on with respect to your mental health, I think it is absolutely worth reaching out to a mental health provider or a psychologist. What I can guarantee students is that when they reach out to me, I am very likely to be the one to do the intake. So at the intake, you are totally welcome to express any anxiety, any fears, any hesitations that you have, and allow me to answer or address any of your anxieties, concerns, or questions to your satisfaction so that you can make an informed decision about would you like to proceed. And so, I think that whether you're reaching out to the University of Hawaii Mental Health Services or you're reaching out to a private provider, I think that people have to be very selfish. And if you feel like the provider that you're reaching out to, you don't like the way their tone of their voice, or you feel uncomfortable about anything related to them, I encourage people to be selfish and to say, hey, wait a minute, I don't feel comfortable. Let me see if I can find another provider who I might feel more comfortable with. So comfort is very important. I would encourage people that there's probably never going to be a time where meeting with a complete stranger and sharing personal information with them is going to be comfortable. But I do think that if you kind of approach it from a stance of curiosity and you're assessing the mental health evaluator, just like the mental health evaluator is assessing you, I kind of take it from that perspective and then to make the best choice you can about your treatment.
Yeah. I think that makes a lot of sense, coming from a student's perspective. Yeah, I think definitely just reach out, ask that question, make that appointment. I don't think it can hurt, you know what I mean? In any stretch of the imagination. So if you're the things that you want to improve on, if you're struggling, absolutely reach out and utilize these resources because they're available to you. That is so important to hammer home, that these services are available to you as a student, free of charge. That's amazing when you think about it, right? So, and then just to focus in on some of the details there, you mentioned telehealth. So when we talk about telehealth, is that more Zoom, phone call, text message? What modality, if you will?
That's a great question. So, to be able to provide treatment and to be able to do that well, we do require that people use a system where we're capable of both visual and audio interaction, much like we're doing now.
Yeah.
So, we use a Zoom platform with privacy features that allow us to deliver care in a confidential manner.
Gotcha. Okay. Cool. And then moving past that kind of initial meeting, right? What are the next steps? What are the options that are available to the student? What can they kind of expect? You know what I mean?
It's a really great question. And I think that, because therapy is so anxiety provoking, it's very understandable that people would be like, well, can I just skip the intake? Like, do I have to go through the intake and then, then get connected with a therapist, right? And I completely understand that. Now, the issue with that though is access to care. So before we developed the model that we have now, students were sometimes waiting about 3 months before they would be able to get to an appointment because we had no way to triage students. We came up with a very sophisticated process by which we can do an intake, which allows us to triage students to the best kind of care possible. By that model alone, we were able to move from a 3 month wait list to having no student wait more than 2 weeks for an appointment,
Wow.
right? We were also be able to, we expanded the services that we had after the model compared to before the model by almost 200%. So by implementing this model, we have increased access to care. While it is a little bit more uncomfortable upfront for a student to have to go through an intake and then get connected with the therapist, I think that it does actually allow us to treat more students and to provide more competent care to a broader range of clients. So, what they can expect in that initial meeting is that students, when they come for an intake, can expect that I'm going to take time to ask them, do you understand the informed consents? Do you understand the limitations of confidentiality? Do you have any questions about your treatment or what to expect? I will do kind of a preliminary assessment to kind of figure out, okay, what is the severity and the complexity of the issues that a patient or a client is presenting with? And then I will offer an opinion. So I will give the client or the student an opinion about what I think they need. And we kind of negotiate, right? Because it's important that if you're going to a doctor and you're receiving treatment from them, that you agree with what it is that you're receiving care for. So we try to work out any of those disagreements. I take my time, explain what therapy is, provide a lot of information. And then at that point, based on the student's mental health needs, they get triaged. So either assigned to kind of our wellness programming, where we can do more supportive counseling, which is ideal for students not suffering from severe mental health issues, or we have the clinical leg, where students who have a little bit more severe issues that need a little bit more specialized care and sensitivity to the care that is delivered to them, they get assigned to a certain category of care. And that's what happens. And then they get connected with the therapist and hopefully have a good experience with one of the therapists that they're connected with.
Gotcha. Thank you for that. I think being able to like visualize the process and like what to expect, I think that could be like really helpful for students. That kind of clarity and transparency is really amazing, and I really appreciate it, Dr. Taketa. Yeah.
Appreciate it.
And then you also mentioned confidentiality. And in prepping for this episode, I tried to think of questions or concerns students might have going into the process, right? So the next question I have, it might be a little pointed, and I apologize, that's not my intention, but
Oh.
I think it's important to ask. So the question is, how does your team maintain both impartiality as well as confidentiality in situations involving potential conflicts of interest? For example, in the unfortunate situation where a student may be experiencing challenges with a faculty member, what steps does your department take to ensure that the student feels safe and supported?
That's a great question. I'll do my best to answer that, and let me know if I don't give you an answer that kind of satisfies your curiosity. So, to maintain a stance of objectivity so that we are operating and are committed to every student's best interest with respect to health and wellness. So our goal is that all of our therapists and our the people that work at our center have to be fully committed to the best interest of every student's mental health and wellness. So what does that entail? Well, all of our therapists receive extensive training on monitoring of biases, right? So we monitor our biases, we identify our own internal thoughts and feelings. We also have a regular meeting where mental health professionals get together and we talk with each other about our biases to make sure that we can receive consultation, that what we are doing with our patients are not the result of any of our biases, whether it be our employment or anything else. And so we regularly monitor our biases. If you come to treatment at our center or from any of our therapists, you are very likely to hear your therapist talking about them. So our therapist will share our thoughts and our feelings with clients, of course, appropriately, in an effort to have a conversation with the client so that we can both client and therapist can work together to kind of manage what our biases are and our personal opinions are to ensure that we're always working to the best interest of the student. With respect to confidentiality, there are laws and ethics that govern that for us. And so, for instance, with respect to confidentiality, let's say that even if it was a conflict between a student and a professor, it would be a conflict of interest if the therapist would weigh in formally in on the side of the therapist or the student. So that would be beyond what our scope of practice. We educate our providers not to get into that. But what we can do with students is explore, well, what are your solutions? What are the possible solutions you have for this? And then talk about the strengths and weaknesses of the various choices that you can have. So our center explicitly prohibits us getting involved in any kind of multiple relationship where we are functioning outside of the delivery of care, direct care to the students. And so, with respect to confidentiality, basically everything that a client shares in a professional relationship with their therapist is confidential, except if there's a legal requirement, say like I get subpoenaed by a judge, if there is a disabled, an elderly, or a child who is at an imminent danger of harm, imminent meaning like right now, like they're like right about to be harmed, of serious harm, or if a client is in imminent danger of serious harm to themselves or other people, those are very specific. It's quite a high bar.
Yeah.
So basically, everything outside of that is confidential and protected by law and policy.
Not only did that answer satisfy my question, but I think it's really important to emphasize like the amount of transparency there and the amount of processes that are there. If a student is unfortunately in a situation where they're facing that type of thing, I think hearing those answers will definitely alleviate some of that like anxiety for sure. So seriously, thank you very much for that answer. And yeah, the amount of processes and transparency, I'm really impressed, and it's amazing. It really is. So thank you.
Thank you.
Yeah. All right. Before we shift over to burnout, is there anything else kind of on the services side of things that you would like to discuss? Are there any questions that I should be asking that I'm not? Anything like that?
No, I think the only thing that I might add, which is an area of understandable confusion for people, especially if you've never had mental treatment, is that there's a difference between mental health treatment and venting. And so, well, we're very, very happy to hear people vent. As a licensed psychologist, we are not capable of providing any service related to mental health outside of what our license says that we can do. And our license gives us a license to provide treatment. So, well, we would like to be able to just kind of talk story with our patients. We do need to make sure that it qualifies as treatment because that's our ethical and legal responsibility. So, which means that we will be having treatment goals, right? And we will be rendering a diagnostic opinion, whether there's no diagnosis or a diagnosis, and that we will actively be working towards health and wellness. And that's kind of the difference between treatment and venting. So that's the only other thing that I would add.
Gotcha. So when you attend an appointment with your department, it's for a purpose. You're working towards a goal. It's not getting coffee with friends, if you will. Is that
That's
what?
right.
Okay. Gotcha.
That's right.
Thank you for that clarification. I really appreciate it. Is it okay if we shift over to burnout?
Sure.
Cool. So I think burnout's important to address because I think at some point in every student's journey, they're going to experience it, some more than others, right? So I think a good place to maybe start is to define burnout. And in what ways does burnout differ from the stress that provides a sense of motivation, if you will? You know what I mean?
Ah, that's a great question. Burnout, in the context that we're using it, typically refers to a state of psychological and physiological exhaustion, which means that as a result of being under typically a prolonged sense of unhealthy stress based on circumstances or could be based on psychological issues, to the point where the hormones and the chemicals associated with maintaining that level of stress begin to break down our healthy functioning both psychologically and physically. Burnout can have very mild to no effect on someone's long term mental health or long term physical health, all the way up to the more severe cases where it can actually lead to very serious psychological illnesses or even death, right? So there's a huge spectrum of the impact that burnout can have. And you mentioned a very good point about healthy stress, which is sometimes referred to as eustress. So I think it's really super complicated in the fact that people will use the term burnout very loosely, but then not really identify, well, what is the cause of their experiences. So if somebody is engaging in healthy stress, this means that the stress that they are engaging in reflects a reasonable and rational appraisal of their situation. Let's say that you are studying to overcome your finals and you are coming into it confidently, you are studying hard, and that stress is causing you to remain focused and to persevere. And then once you're done with that final, you're positive, you feel like you did a great job, right? That's eustress. That stress is positive, it's healthy. Or let's say that you're having a conflict with a friend and you're feeling a little stressed out because you care about them. And because you care about them, that encourages you to have a dialogue. It encourages you to have good, healthy communication. That would be eustress. Now, burnout, just like if you were to run a mile or you were to paddle a mile on a canoe, and if you were to do it, and let's say that you were to do it for a prolonged period of time, even if paddling is healthy, you're going to get to a certain point where it becomes unhealthy and your body starts breaking down and you don't have the energy to continue. And if you keep pushing yourself, you're basically looking at being injured. So, the complicated part about burnout is that if you're dealing with mild burnout, by all means, check out Google, research stuff, deep breathing, meditation, all that good stuff works. But we have to be real with each other because if your burnout is the result of legitimate stress, let's say that you are in an unhealthy relationship and you are in a constant conflict. You're working 3 times as much as you should be working because no human being can work that much. There's no amount of deep breathing and meditation that's going to help you. Your body is telling you you need to cut back. So oftentimes what I recommend is that even if you're dealing with moderate burnout, talk with somebody because they can help you to determine, is this a situation where we need to change your thinking and coping skills? Or would I actually be hurting you by helping you to cope with something that you should change?
I find that last point very Interesting. Can we go a little bit more in depth on that?
Sure, sure. I'll give you an example of a very broad, generalized case that I've seen many times here. I've worked with a lot of parents, good parents, and oftentimes these parents will be kind of caregivers by nature. They take care of their children, they take care of their spouse, and they're going to school and they hold a full-time job, right? And so these individuals are kind of like superhumans and they're just really admirable. But sometimes the reason why they take on so much is because they don't have a lot of assertive communication skills. They're not able to tell people no. So what happens is that they overextend themselves and then burnout ensues, and then they come to therapy. Good choice, right? But in the course of therapy, they're asking, can you help me with my burnout? I don't want to feel overwhelmed all the time. Well, if we just lower their reaction to their legitimate reaction to being overwhelmed, we're essentially helping them to stay sick.
Mhm.
But we're essentially helping them to be in an unhealthy environment where they're not able to really tell people no. The alternative to that is to really educate the client that there's some deeper insecurities and psychological stuff that make you feel like you're not valuable when you say no. And that's not okay to live your life that way because you're better than that. So then being able to help the client do to lower the impact of burnout is one thing, but also focusing on enhancing assertive communication skills and improving their sense of self-worth would be the best way forward for that individual rather than just almost like giving them a Tylenol for the pain that's letting them know that something's wrong.
Gotcha. Makes perfect sense. To me, it's like kind of you have external forces or factors that contribute to burnout, but then there's also internal forces that contribute to it, right? So
That's right.
navigating and addressing both of those requires perhaps different approaches, different thoughts, right? So, yeah, it makes perfect sense. When we think about those kind of high stress points in a student's life in relation to academics, the beginning of the semester, midterms, and finals, how can students most effectively prepare and manage going into those times? Are there certain ways or certain things that they can do to prevent burnout during those moments?
That's a wonderful, wonderful question. And I think that, I want to go to the canoe paddling metaphor. So, and I'm certainly by no means a professional canoe paddler, but what I found is that in my earlier kind of experience with canoe paddling, when we would do a distance that I wasn't familiar with, I would have a lot of negative thoughts in my mind. Right. And these negative thoughts, they would say things like, you're not going to make it, you're going to letting your teammates down, right? And all of this kind of stuff. We want to approach it in the same way. So before I get into the canoe, it's often very helpful that I identify where is the root of these irrational thoughts that when the tides come and when the race gets really difficult are going to start wreaking havoc in my mind. And so what I would recommend is that for optimally, if you know that you tend to have a little bit of a challenge when it comes to midterms and finals, there's very likely even unconscious or deeper issues that you might have with your sense of self-worth, your sense of competency. And if we can handle that before you get into the canoe, before you start paddling down the semester, by the time that you hit midterms and finals, if we can address that core challenge that you have, you're going to be able to manage the midterms and finals a lot better. Ideally, reach out to us early, get that good foundation going, and then we can support you before and during and after your midterms and finals. And if you're like me and you just jumped into the canoe and you didn't know what you're getting into, and you hit finals or midterms and you're feeling overwhelmed and you don't understand it, no problem. Let us be able to help then, because we might be able to break it down for you and help you to separate what is the good stress versus the unhealthy stress, and then plan for the future.
Prevention is obviously inherently optimal, but say a student missed this episode or they didn't come talk to you early and they're actively dealing with burnout. How can one, I don't know if recover is the right word, but how can one recover from burnout? Are there certain strategies that a student could implement to help them kind of get out of it, if you will?
That's a great perspective. And I want to address the very first point that I think that you were making, and I appreciate it very much. First of all, I really want to encourage everybody who's listening to delay the shame response. Because when I reached out for help for the first time and my world was kind of crashing down. I didn't do none of that preventative stuff that I knew better that I should have done. I knew everything. If anybody should have known better, it was me. But when you're going through life, it's really hard to objectively analyze yourself. So if you find that you are in the midst of a crisis and you're thinking, well, I should have done something sooner, well, I just encourage you to stop and be compassionate because you did the best you could and that you never thought or wanted to be in that state of crisis. So really, delay your tendency to blame yourself, and then to get help. I think that if you're coming into a place of total burnout and you're already experiencing some of the negative consequences, just like you would go and get cared for in a hospital when you're sick, it's not ideal or optimal, but it sure is nice to have an individual kind of walk alongside you with what you're struggling with, to be an objective voice to help you to organize, understand, and process the things that you really can't change in your current environment will inevitably lower, I would expect, would at least give you some relief. But then, more importantly, if you are in the midst of a crisis, the number one thing that we can offer you is hope, right? So if we can kind of break down the suffering that you're in at the moment, well, it may not take away the suffering. We can then help you to partner to have reasonable and realistic hope so that you can begin to have faith in your ability to recover and to be an ultimately better version of yourself. And I think that that hope can be really impactful.
Absolutely. I think that's so important to maintain a sense of hope. That's what guides you forward. It's not only your foundation, but that's the light leading you in a way, right? Does that make sense?
Absolutely.
Yeah.
Makes total sense.
Are there recovery habits or practices that everyone should consider, should implement? Or do recovery methods tend to be more effective, if you will, if they're personalized to personalized interests or hobbies, those types of things?
We're talking about, are there kind of specific and generalized tips that
Mm-hmm.
we can offer that would help to basically promote everybody's wellness, and are there more specialized things that based on your unique circumstances and personality that might be helpful? So I think the answer is yes to both.
Okay.
And so I recall working with a really fantastic, wonderful middle-aged woman, and she was amazing. And I really think about her all the time. And she was probably one of the worst cases of burnout that I've ever seen because she was just a giver and a caretaker, and life just took advantage of her. I share her case because once burnout hits, even if you do a lot of good, healthy coping, even if you make immediate changes, you're not going to experience them right away. It's like going to the gym. I want to get into shape. You can go and work your butt off, for that first two, three, 4 sessions, but you're not going to see the results unless you keep at it. So the first thing that I want to say is that if you are at a place of burnout, certainly seek help. We can definitely offer some level of relief, but until you implement life changes, you're probably not going to see the full benefits of the intervention or the changes that you see. And there's certainly some personalized things because our insecurities, which certainly influence how we process burnout, are unique to the individual. But the number one thing that I have to educate people is that we live by nature in a very unhealthy society. We were never designed to be anxious or stressed out for a prolonged period of time, just enough to get away from an enemy. But here we are in higher education where it takes people 4, 5, 6, 7, 8 years, 10 years sometimes before they reach their goal. That's a long amount of stress. So, what I want people to know is, for example, the experience of loneliness is more unhealthy for people than smoking cigarettes. So we are in a society where we understand the health consequences of smoking cigarettes, but the experience of being lonely is more toxic for your body and your brain than smoking cigarettes. And we think about health related illnesses. There is nothing more impactful or more dangerous for people than prolonged stress. Stress and associated health conditions cost Americans in healthcare more money than anything else. And so when we're really putting this into perspective, if we are going to be mindful of how we care for ourselves, we have to integrate and practice a balanced life to the extent possible. which means that we have to have a good portion of our plate filled up with schoolwork. But we also have to make sure that we have our vegetables and that we have time with friends and family and loved ones, that we have space for our spiritual endeavors and to that we can live and we can have a balanced life as much as possible. And when I referring back to that woman that I treated for burnout, at one point I told her that as a doctor, I am telling you that you must cut back at work. And if you do not, that your prognosis is going to be very bad. This is not necessarily a recommendation anymore. I am giving you reasonable feedback here that just like you would with a doctor saying you must take this medication to get better, the same thing has to go with living a balanced existence. It's not really a want, it's really a requirement if you want to be healthy.
That makes perfect sense. Yeah, I didn't know that loneliness is literally worse than smoking cigarettes. I think that's important for people to understand that these issues and these topics have real health consequences. These manifests in very real ways, right? So by reaching out and seeking help, that is incredibly important. It's incredibly important. And then another thing you mentioned as well, the kind of gym analogy, right? Say you go on a diet and you try to lose weight. It took you years to gain weight. It took you years to become overweight, obese. You're not going to just drop 50 pounds overnight. It takes months, if not years, to lose that weight, right? So it takes effort, it takes time. I think that's also important to hear and put it in that kind of analogy as well. Once again, I cannot emphasize to the listeners enough. If you need help, if you're struggling right now, absolutely reach out and utilize Dr. Taketa's services and his team. The processes that are there are amazing, and I'm sure that he would be more than helpful. Really life-changing stuff. So yeah, Dr. Taketa, thank you once again for coming on the podcast. This is absolutely fantastic. Before we go, is there anything, again, that I missed? Are there questions that I should be asking that I'm not? Anything like that?
No, there's nothing that you missed, but as a graduate of UH West Oahu, my wife's a graduate of West Oahu, my daughter's a graduate of West Oahu. From one graduate to another, I really thank you for what you're doing and for giving space to talk about a very sensitive topic and encourage people to put themselves first. So I appreciate all you do.
Oh, thank you, Dr. Taketa, and I absolutely appreciate everything that you do as well. Thank you so much, and yeah, good luck at those canoe races, and I'm sure you're going to do great. Thank you, Dr. Taketa. Mahalo for listening to Transfer Talk. The views and opinions shared by the hosts and any guests are solely theirs and do not reflect the views and opinions of UH West Oahu or Kauai Community College as an institution. If you enjoyed listening to this episode of the podcast, please like, share, comment, and check out all the other episodes. Aloha.